Hello everyone. I am Dr. Sarosh Siddiqui, also known as DSS, and I'm the founder and the lead tutor at UKMLA with DSS. So UKMLA with DSS is basically a platform, or I call it a one-stop solution for all the UKMLA aspirants, because we provide a comprehensive solution to your UKMLA journey. May it be the general counseling, visa related queries, and then your very first step to the UKMLA journey, that is your IELTS or the OET exam, uh, followed by the PLAB 1 or the UKMLA 1 exam, and then the PLAB 2 or the UKMLA 2 exam, and then the components that are required for your CV building, which includes a very major aspect of your NHS profile or your GMC profile, that is the clinical audits. So it's a one-stop solution, and we are offering all these services. And most importantly, the service that I'm actually very proud of, and the service that has helped me create a major difference in the results and in the life of the UKMLA aspirants, is the personalized one-on-one mock for the UKMLA 2 exam that we conduct. We've got an amazing mock, a very detailed feedback, and that has really helped a lot of candidates clear their exam, specifically those candidates who were not able to clear their UKMLA exam in the very first attempt. After taking our mock, they got the personalized feedback. They got the idea on what are the do's and the don'ts of the PLAB 2 exam, and then eventually they ended up clearing the exam at a very good score as well. So that is a comprehensive overview of what we offer and what we do. These videos that you're watching right now is basically the comprehensive course or the basic course of the UKMLA 2 exam. Uh, because UKMLA 2 exam or the PLAB 2 exam, it's a very challenging exam, to be very honest, and like most of the doctors and most of the medical students, they do not have the habit of failing an exam, because you require highest level of academics to get into a med school, and then doctors are generally considered studious and high achievers, and people who achieve academic excellence. But this PLAB 2 exam, this breaks your bubble, and this is often the first exam that most of the doctors fail. Not to demoralize you, but since it's the start of the course, and if you're watching this video, I'm assuming that you're yet to give your PLAB 2, or maybe you've given it, or you're yet to give your PLAB 2 second attempt or the third attempt. So it's very imperative, and it's very important to identify this thing at the very beginning, that PLAB 2 is not just an exam that you'll just go and clear without a significant preparation, or just on the basis of the luck. Yes, the luck factor is there, like it's definitely there, but you need to prepare yourself, and you need to work according to the demand of the exam, according to what the GMC examiners are looking, and what are the criteria that are important in order for you to pass or fail the exam. Okay, so before I go into the detail of what the exam is, let me just clear some confusion and some misconceptions that people have. The most common misconception that a lot of people have is that they say that PLAB 2 is just a communication exam. Like, you can go out there, you can just go and talk to the simulator for 8 minutes. You just go and talk nicely, you be empathetic, you keep on smiling while you're doing the station, and you just try to act nice, and that is all that you need. And if you're just doing that, you will be able to clear the exam, and you will be able to get things done, and you'll be able to pass the exam. But that is not true. Communication, yes, it's a major aspect, but that's just one aspect of the exam. uh, PLAB 2 is also testing your clinical knowledge, and this is something that a misconception is created in the minds of the IMGs, that you don't need to be clinically sound. And I have heard a lot of tutors say that your clinical knowledge has been already tested in lab 1. They would not be looking at your clinical knowledge. All they would be looking at is your communication skills. That is not the case, because clinical knowledge and clinical management and clinical assessment skills, like it does make a very major component of your exam, and you cannot step into the exam without being clinically sound. You cannot just go and sit in the exam without having appropriate clinical knowledge, because uh, yes, communication is important, but the kind of confidence that you would have while communicating with the patient, okay, the kind of clarity that is needed in your consultation, that wouldn't come without a clinical knowledge. Okay, that wouldn't be there until unless you know what the stuff is, you know what to do in a particular type of station, or you know that okay, this is how I'm going to manage a particular situation. So the knowledge part is like very important. And to all the lab book candidates who are preparing and who have just started their preparation, do not just keep on blindly practicing it with multiple partners and think that okay, I've practiced for 4 to 5 months, I'm going to ace the exam. That is not true. Yes, practice is important to improve your communication skills, to make sure that your consultation is like very smooth and very free flowing. But at the same time, you need to read. You need to read a lot of stuff, and you need to apply that knowledge in the right way, in the right structure, in the right manner, to make sure that you score the maximum, and you make sure that you're clearing every station. Not every station, but at least the number of sessions that are required to clear the exam on that particular day. So with that being said, that two domains, communication and clinical knowledge and clinical assessment skills, it is tested at various points in various different ways, and they have a complex kind of a structure of how they mark and how they assess you in your PLAB 2 exam. So I'm pretty sure some of you might be familiar with this exam structure, but for those who are not familiar with the exam structure, what I would like to do is that give you an overview. So this is an OSCE based exam, which means there is a clinical scenario that would be given to you, and there would be some simulators who would be talking to you, who would be discussing a particular case with you, a particular concern with you. They might be here to collect some test results. They might be angry at you, or they might be here to listen to bad news that you are about to deliver to them. So there would be different role plays that would be taking place. Okay, that is what the basic format of the exam is. And there are 16 different stations. Each station comprises of 8 minutes. Okay, and in those 8 minutes you need to show your communication skills and your clinical management skills as well. Okay, so these 8 minutes and these 16 different stations, in these they are testing you on basically 3 different components. Okay, the very first component that they are testing you is your interpersonal skills. Okay, and what I mean by interpersonal skill is it basically determines that how good of a communicator you are, how well you're able to talk to the patient. Okay, how well you're able to communicate not just your words, not just your ideas, not just your knowledge, but how well you're able to communicate your body language to the patient as well. Okay, so interpersonal skills is not just you speaking nicely and you just smiling throughout the consultation. It's a lot more than that, and I'm going to break it down to you guys, that okay, what are the components, and what are the things that you need to focus on in order to score high in your IPS. Okay, then comes your data gathering, technical and assessment skills. Like by the name of it, it just sounds like it's just history taking, but data gathering is also a very essential component, in which yes, you do have to ask questions, but your data gathering is not just asking questions. It's about how you ask those questions, how you are, able to connect the dots, how you are able to relate to the situation, and how you are able to use this particular data in order to, help you in your clinical management skills. And the third aspect of it is the clinical management skills, in which you actually have to manage the patient, you have to manage the condition, you have to manage the situation. Each component carries four different marks. Okay, 4 marks for your interpersonal skills, 4 marks for your data gathering, and 4 marks for your clinical management skills. And total, that makes it around 12 marks per station. And as you can see on the screen, that most of the station, the passing marks is not a lot. It's six, 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 six. In a few station, you might see 7 as the passing mark, or in a particular station you might see 5 out of no, 12. That would be the minimum pass score. Okay, so you understand that it's not easy. Okay, like there is a reason why you are just clearing the station on just half of the total marks that is dedicated to a particular station, because people are not even scoring that. And the main reason why IMGs like us, we struggle in scoring, because we don't know that what exactly IPS is. We do not know what exactly data gathering is. We do not know what exactly clinical management skills is. Okay, so that's why we are not able to score very high in these, and that is why we score around 6 7. And it's kind of difficult to score high in every station, because GMC examiners are like very very critical about it. Okay, the marking and the scoring that is done, it's done in a very critical manner. And let me like put this thing very clear, and at the very beginning, that the margin of error that you have in this exam is very less. Okay, unlike your PLAB 1 exam, in which out of 180 questions, even if you mess up 50 of them, it wouldn't have mattered, because you would have still scored 130, and you would have still passed the exam. Okay, but in this case you cannot put a foot wrong, because the GMC examiner are like really really critical about it. Okay, and you do not have a very big margin of error. Okay, the margin of error is very very low. Okay, so you need to be on the top of your game, and if you want to clear this exam in your first attempt, or in your upcoming attempt if you're giving another attempt. All right, so I'll break down all the three aspects for it. I would really want you guys to take notes and write it down, because the more you write, the better it gets ingrained in your brains. So let's start with what the data gathering is. Okay, 4 marks for data gathering. Okay, so now most of the people, they think, and most of the candidates, they assume that if I'm just going to go out there, if I'm just going to ask 50, 60 different questions, I'm going to score high in my data gathering. But that is not true. Your data gathering is not just, you asking questions. Okay, it's not the number of questions that you are asking. Okay, somebody might go out there and may ask 25 different questions, and he or she will come out of the exam, and they would say that, okay, I've done great, I'm pretty sure I'm going to get 4 on 4 in my data gathering. Why? Because I asked 30 different questions. And at the same time, someone who would have asked maybe just 6 7 questions, they might be scoring a 4 on 4, instead of the person who just asked 25 30 different questions. Okay, so it's not about the number of questions that you are asking, it's about the relevance of the questions, it's about how structured your consultation is. Are you asking the right thing? Are you asking the relevant things? Okay, just because it is there in the scripts, just because people have made their notes, and people have published and edited their thick notes books, and published it in the market, uh, and written hundreds and hundreds of questions for every different case, that doesn't mean that you have to go and memorize and rote learn those questions, and just ask those questions in that particular exam. Okay, your consultation has to be very natural. Okay, do not just ask a question for the sake of asking it. Okay, there has to be a logic. Like, what do I mean by logic? Like, for example, somebody comes to you with the complaint of chest pain. Okay, and you're asking, does this pain go anywhere else? Okay, so because you have studied this thing that okay, I should be asking about radiation when you do the Socrates. I have to ask about the radiation of the pain. I'm just going to ask, does it go anywhere else? What do you mean by the fact that does it go anywhere else? Where does it go? Chest pain going to the back, chest pain going to the abdomen, like where? So your questions have to be very directed. Okay, like let's suppose if you want to say it in a better way, you could have said that okay, by any chance does this chest pain go to your left arm? By does any chance does it go to your jaw? Does it go to your neck? Or does it go to your back if you're thinking about aortic dissection? Okay, so whatever you are saying, there has to be a logic behind it. Okay, that is what I call it as the differential oriented data gathering. Always have the differentials in your mind. Okay, that what are you trying to get from that particular question? Okay, smoking, if you're asking about smoking, by any chance do you smoke? Okay, so yeah, I do get that. Okay, because smoking is one of the risk factors for chest pain for MI. So if you're asking about smoking in this particular case, that would completely make sense. But let's suppose that somebody has come to you with right lower quadrant pain, and you are thinking about appendicitis in this case. Okay, or maybe if it's a woman, you're thinking about ectopic pregnancy in this case, and there you are asking about smoking, and you are getting into the detail of smoking. That doesn't add up a lot. Okay, like smoking is not the risk factor for appendicitis, neither it is the risk factor for ectopic pregnancy. So if you are asking smoking just because it is there in the script, you wouldn't sound that mature enough. You wouldn't sound very directed. You wouldn't sound relevant in this case. That I would say. Okay, so always make sure that whatever you are asking, that is like very important, and it is specific. Okay, and there is a logic behind why you are asking this question. Do not end up asking about profession in every case, in every case. Okay, yes, there are a few cases in which you have to ask about the profession. Like for example, if you are discharging a patient, let's say, you would have to ask about the profession. If they are a mechanical worker and they just got discharged from a surgery or from any medical illness, they cannot work at the construction site, understandable. Okay, but there has to be a logic behind it. Not for every case you're going to ask about what your profession is. Okay, let's suppose that somebody comes to you with a concern. Okay, with just a concern that okay, they want to get a vasectomy done. Okay, like asking about profession may not be very relevant in that case. Okay, he just wants to inquire about a procedure. Okay, he wants to get a vasectomy done. His profession is not that relevant. Okay, so if you have got the time, okay, fine. If you do not have anything else to ask, if you've got the time, if you've covered all the major aspects of the data gathering, then you may ask about general questions that may or may not be relevant, but try to focus on the important things, because 8 minutes, and in those 8 minutes you have to do the data gathering. You have to be at your best communication skills. You have to clinically manage the patient and clinically manage the scenario as well. So it's a very demanding task. Okay, and you don't want to waste your time in asking the irrelevant questions. Okay, other than that, if you see that the 4 marks that are mentioned on the screen, it's not just your data gathering. Okay, it's not just asking multiple questions. Okay, it also states that it's the data gathering, technical and assessment skills. Okay, now what most of the people and most of the candidate they miss is the technical and the assessment part. Okay, you have asked about the relevant questions. Okay, you have shortened your data gathering. Okay, you have asked differential oriented questions. That is fine, but now what is the technical and what is the assessment skill? Okay, I'll break it down for you. Now, the technical skill is basically, how you structure your consultation. Okay, how you are able to maintain a nice flow of your consultation. Okay, and that is where most of the people lack. Even after doing a very good data gathering, if it's not structured, if you're not asking the right question at the right time, okay, in the right way, you're not doing the right data gathering. You're not doing a technical data gathering. Okay, let's suppose that you're trying to explore chest pain first. Okay, let's suppose somebody comes to you with a chest pain. Okay, let's go back to the same example. You started exploring, okay, what the chest pain is, okay, and you did not explore it completely, you did not rule out all the differences completely, and then after, right after a couple of questions, you just move to past medical history, or your smoking history, or your diet, your lifestyle habits, your profession, and then you suddenly remember that, oh, I did not rule out enough differences because this data is not helping me go to a right diagnosis, that whether it's pericarditis, whether it's pulmonary embolism that is causing the chest pain, or it's an actually MI that is causing the chest pain, or maybe it's just something harmless like a gastroesophageal reflux disease that might be causing it. I did not ask about the relation of chest pain to food. I did not ask about the burning sensation. And then after you are done with all the data gathering, then you go back to the differentials, and then you again try to rule those things out, and you ask about the differential related questions, and then eventually, even if you reach to the diagnosis, okay, you would not be scoring high in your data gathering. Why? Because your consultation was not structured. Okay, you did not stick to one particular layer, you did not stick to one particular aspect of the data gathering at one time. Your data gathering was all scattered, it was all over the place. Okay, so the structures are like really important, really important. There are 600 cases in plat 2. You cannot just go and memorize all of those. You cannot just rote learn all of those and then just expect that, okay, I'm going to go in the exam, and as soon as that particular case comes, my mind is going to give me that particular script of that particular case, and I'm going to say it out there, and I'm going to pass my exam. No, what will help you is how you are able to structure your consultation, and how you are able to make sure that you are asking the right question in the right way, and you're going category by category when it comes to your data gathering. That is what the smart way of doing the data gathering is. This skills of yours is going to take your data gathering from here to here, and this is going to increase your marks as well. This is going to like, make sure that you score high in your data gathering. Okay, that is what your technical skills are. Other than that, the next aspect of the data gathering is the assessment skills, and most people just completely ignore what the assessment skills is. They don't even know what the assessment skill is. Okay, so there is a kind of station in lab 2, that is the combined station, in which you actually have to examine the patient. Okay, we are going to talk about that later on. But in that particular type of station, you actually have to go and examine the patient. Okay, so your assessment skills would be much more heavily marked in the combined stations, because you actually have to go there and make sure that you're doing the right examination in the right way. But in most of the cases, in 95% of the cases which are not combined stations, okay, your assessment skills would be how you are able to name the right investigations and the right examinations. Okay, you have to name the right examinations. Like for example, somebody is coming to you with a back pain. Okay, you did not offer the patient a digital rectal examination. Okay, you are not going to pass that exam. Why? Because DRE is important in a back pain patient. There might be some prostate related issues, can be prostate carcinoma, that might be causing back pain to the patient. You just examined the back, you did the neurological examination, you offered the general physical examination, you offered the vitals, but you did not offer the digital rectal examination. Problem. Okay, somebody coming to you with back pain shooting down to the legs, you did not offer the SLRT or the straight leg raise test. Okay, that means you're not able to rule out sciatica. Okay, so you are missing out on differential just on the basis of naming the right exam, naming the right examination, naming the right assessment. That is one very major aspect of your assessment skills that you need to have in your mind. Okay, many people miss out on that, because as I told you, just two investigations I named, and both of them were leading me to a diagnosis. Okay, if you're missing out on that, that means that you're not gathering enough data. Okay, if you wouldn't have offered these particular examination, you wouldn't have reached to the right diagnosis. You wouldn't have reached to the right diagnosis. You wouldn't have treated the patient correctly. That means you are an unsafe doctor. And lab 2 wants you to be a safe doctor. Okay, what the GMC is looking at is that how safe of a doctor you are. Okay, are you a safe doctor or not? Okay, so these technical assessment skills are like really important. Okay, like really important. Other than that, the other aspect of assessment skills are in a few stations you're going to see that the patient may not be even talking to you. Okay, but still the patient would be saying a lot of things. Now, what do I mean by that is that the patient may not verbalize his or her emotion or the thing that the patient wants to say, but the patient would be acting in a few way that it would speak a lot about the patient, that okay, something is wrong with them. Okay, and we call this as the non-verbal clues. Okay, they might be uncomfortable, they might be shaking their head, they might be fidgeting their hands. Okay, and there is a list of non-verbal clues and how to identify them and how to make sure that you make the patient comfortable and how to make sure that they open up to you. So there is a separate lecture for that as well, but just to give you a brief idea that this is also one of your assessment skills. Okay, this is also an important assessment skill that you need to keep in mind. So all of these things combined would help you score a good score in your data gathering. So you understand, it's not just history taking and asking the bunch of questions, the impression that most of the IMGs have. It's a lot more complicated than that, and this is what is expected of you, and this is how you have to do it. All right, so this was for the data gathering. Okay, now let's come to what your IPS skills would be, your interpersonal skills would be. Okay, so the IPS has got 4 marks. Okay, and people say that okay, IPS is tested just in the beginning and how you start off the station, but that is not completely true. Okay, IPS is something that is tested throughout the 8 minute of your consultation. Throughout. Okay, data gathering is something okay in the initial data gathering minutes, and then management is something that is being considered and tested at the end of the station. But IPS is the thing that is checked throughout the station. Okay, if you are at the highest level of your IPS in the beginning, okay, and then you are not able to maintain it, and then if you are not able to make sure that you maintain that level of your IPS skills, your marks will eventually go down at the end of the station. Okay, so you need to be very cautious, and you need to be very careful about your IPS skills, and not consciously. Okay, IPS skills is something that cannot be developed like in a conscious way. It is always in your subconscious. Okay, that you need to be at the highest level of your IPS skills, and the more natural you are, the better you're going to score. Okay, if your personality is that okay, you're not into smiling, and you're not very a happy jolly person. Okay, don't try to be and don't force yourself to be that happy jolly person. Don't try to force a smile on your face. Okay, if I'm smiling like this and if somebody just smiles like this, even that is fine as far as somebody is smiling. Okay, so if you force it, it does look a bit extra on your face. Okay, so in your IPS skills, you do not have to force anything. When I take mocks, I have seen candidates faking it. Oh, I'm so sorry. That must have hurt you so badly. I can understand that you must be in a lot of pain. It sounds really fake. Okay, so you have to empathize with the patient, but at the same time, you need to make sure that you're not faking it. Okay, you need to make sure that it doesn't look scripted, it doesn't look fake on your face, because if it is looking fake and if it is not looking original and if it's looking scripted, then I'm sorry, you would not be scoring well in your IPS skill. In fact, that would have a very negative impact on your IPS. Okay, so you gotta make sure that you are displaying your IPS skills in the most natural way possible. Okay, now what are the components of the IPS that is needed, that you need to have in your mind? Like nobody tells you about this. Okay, it's a very vague. We mentioned in the academic courses as well, on the GMC website as well. but I'm going to break it down for you. Number one, the first and the foremost thing is your clarity. Okay, whatever you are saying, your tone needs to be very, very clear. Okay, whatever you are speaking, it needs to be understood by the layman sitting over there and listening to you. Okay, you cannot just rush and do that like this. You cannot just go very slow, that to a point that it becomes difficult for a particular individual to understand what you are saying. Okay, so you need to strike a balance in your tone. It needs to be very, very clear. Okay, number one. Number two, you need to be confident in your consultation throughout the station, because there will be a few stations that will deliberately try to break your confidence, like for example the medical error patient, or the medical error station, and the angry patient stations. Okay, the patient is going to shout at you. Okay, and the patient is going to give you a tough time. Okay, but you need to be confident, number one. Number two, there would be some cases in which you might not be able to easily come to a diagnosis, and things may start to feel a bit difficult during the session. You do not have to lose your confidence. Okay, you have to remain confident, and you have to make sure that whatever you are speaking, it needs to be backed up by your clinical knowledge as well. And that is how the only way that your confidence will come out. Okay, so clarity, confidence. You get two things. Okay, then a very, very important thing is the rapport building. Okay, so rapport building is the first is it's the very, very first thing that you would do even before start off your consultation, and even if before you start with your data gathering. The rapport building is very, very important. Just think about it. On a morning, you went to a doctor. Okay, you are ill, and you are not feeling well. Okay, and the doctor just talks to you with a very sad face and in a rude tone that, hi, how are you, I'm Dr. Siddiqui, can you please tell me what has happened to you today. Like, you wouldn't feel nice. Okay, it wouldn't feel good to you, right? So try to make sure that whenever you are uh, opening the station, okay, you try to build a good rapport that, hi, I'm Dr. Siddiqui, I'm one of the FI2 doctors for today. May I please know your name? Can you please tell me how I can help you? Can you please tell me how you're feeling today? Okay, so just a nice introduction to make sure that that tone is set, that rapport building is sorted, and you have that kind of relation. You are able to build that kind of you know relation with the uh, patient, because that is what is going to set the tone of your consultation. Okay, that initial 10 seconds is going to determine how your 8 minutes go. Okay, so you do not want to give a initial bad expression. Okay, and that is what I mean when I say that the rapport building goes a long way. Okay, it needs to be like in control throughout the station, because you may be at a very good behavior, you may build a very good rapport in the beginning, but in the middle of the session, at the end of the session, you end up saying a few things, you end up not being confident, you end up offending the patient in some way or the other, and then your rapport building would go down. So the mark that you got initially for your rapport building may just like slip away from your bucket in the middle of your session or at the end of your session. Okay, so you need to be very, very cautious with that. Other than that, you need to sympathize with the patient. Okay, like as I said, you need to sympathize, but not in a scripted way. Okay, it shouldn't look like that. Okay, you are just sympathizing for the sake of sympathizing, because Dr. Sarosh Siddiqui in his video said that you should be empathetic, you should sympathize with the patient. No, it should come naturally that, okay, I'm really sorry that you're going through this. I'm sure that you might be in a lot of pain, and say it in a natural way. Okay, just like the way I said it. Don't go like, oh, I'm so sorry. Are you okay right now? Oh my God, I can't just believe that you're going through so much. That must be really tough for you. Please let me know how I can help you. So you see, you're going a bit extra. So there needs to be a balance. Okay, there needs to be a balance. Okay, you need to sympathize, you need to be empathetic, but don't start crying. Like I've seen, people in the mock, they start crying that okay, you are in a chest pain, your life must be so tough. Why do you want to do that much melodrama? Okay, this is not a dramatic exam, this is not a dramatic class, we are not here for a drama class. Okay, we are doctors. Okay, we need to be empathetic, we need to be able to sympathize with the patient, but not look fake at the same time. So you need to strike a balance on this. And I don't blame a lot of candidates, because that is what has been is being taught in the market, that you need to be empathetic, you need to sympathize, you need to sympathize. And because of that, a lot of candidate does it a bit over, and end up losing marks in the IPS. So a right balance is like very very important. Okay, enough sympathy, balance sympathy. Okay, do not go extra, and do not be on the other side that you're not being empathetic at all. Even that wouldn't be a right approach to go forward with. All right. And then one thing that most of the candidates, they also miss is they do not listen to the patient. We do not have the habit of listening. We do not have the habit of and trying to give the patient a chance to speak, because this is supposed to be a two-way consultation. Okay, this is not just like a recorded lecture that I'm giving right now, that I am speaking and you guys are listening. Okay, it's a consultation, it's an OSCE exam. You're talking to a patient, you need to give that liberty to the patient to be able to speak, to be able to say what they want to say. Okay, so technically you do not have 8 minutes. Okay, technically I would say you have got 6 minutes, because the patient would take at least 1.5 minute to 2 minutes to speak and give you that data. Okay, and since there's a time crunch involved, what most of the IMGs, what we are so inclined towards, is that we just want to complete the session, we just want to make sure that we have asked all the relevant questions, we have discussed all the clinical management pointers. Okay, and that is where we go wrong. We are so adamant on the fact that we want to complete the session. I just have a lot of knowledge in my head, I know this case, I know the management of MI, I just want to speak everything. And in that rush, what we do is that we end up not allowing the patients or the simulator to speak. We end up not allowing the patient to share their concerns with us, and that is something that have a very very negative impact on our consultation. So you make sure that you are actively listening. Okay, and what I mean by actively listening, because because a simulator, what they do is that they end up giving you a lot of information in one statement. Okay, often this happens that they do give answer to 2 to 3 questions that might be in your head in one statement, and just because we are not actively listening, we end up asking the same question again. Like for example, if you would have asked the patient that okay, can you please tell me since how long have you been having the chest pain, and the patient might answer you that yeah doctor, I have been having a pain on the left side of my chest since the past 2 hours. Okay, you did not listen to the left side of the chest, you just listened to 2 hours, because that was what your question was. And then after the couple of questions, you are asking okay, can you please point to me, or can you please tell me where exactly you are having the pain right now. And the similar to be like, doctor, I just told you that I've been having it on the left side of my chest. Okay, so that is what active listening is. Okay, you need to listen that what patient is saying, because they've got a 1.5 minute script, and in those 1.5 minute script they give you a lot of information. Okay, and that is enough for you to reach to a diagnosis, that is enough for you to be able to explain a particular condition or a particular concern of the patient. So you need to keep all of these things in mind. So you understand there are 4 marks for IPS, but technically there are 6 to 7 different aspects of IPS skills that are being tested. There is your clarity, your tone, your communication skills, your confidence, your rapport building, how well you are sympathizing with the patient, your empathy, and your listening skills and your active listening skills. Okay, so if you're able to get a hold of all of these things, you would be scoring high in your IPS. Okay, and as I mentioned, maintain it, keep on maintaining it throughout your consultation. Okay, so That is like the two aspects, the data gathering and the IPS. Now moving on to the last aspect of the PLAB 2 exam, that is tested, and that is your clinical management skills. Okay, and like I would really want you guys to listen to this very carefully, because clinical management skills is the section in which the students scores the lowest. Okay, you can see on the screen that this particular result card that I've shared, 44 in data gathering, 43 in IPS, and 38 in clinical management. Okay, 5 marks less, and this is how it's going to be for most of the results card that you're going to see. People score less in clinical management skills. Okay, and that is why in the very beginning I said that PLAB 2 is not just a communication exam, it is also a knowledge based exam, it is also a clinical exam as well. Okay, and you need to identify that your management is the thing that is going to either make your station or break your station. Okay, data gathering and IPS skills you would be able to master. Okay, most of the candidates eventually are able to master that, but management is something that a lot of people struggle, and they keep on struggling on management, and eventually they score low in the management, and that is the reason why people do not clear the exam, because they haven't scored good in the management. They might be scoring 3 on data gathering or 2 in IPS, 5 marks. Okay, so they just need 1 mark out in the management skills to clear the session, but they might end up scoring a 0 in the management and failing the station and eventually failing the exam. Okay, so management is like very, very, very important. Okay, there are three different aspects to the management. Okay, now, but before that, you need to understand that this is a clinical management. Okay, so clinical management doesn't just comprise of managing the disease. Okay, it also comprises of dealing and managing the clinical scenario. Okay, the management of clinical scenario is also very, very important. Management of situation is very, very important. Like for example, you might have an angry patient over there, so the medical management or the management of the disease might not be that important. Okay, it is important but not that important. But managing the scenario, managing the anger of the patient, trying to make the patient calm down, okay, that is what your management skills is. And people don't understand that this thing, that okay, clinical management, that means that okay, for MI I just need to remember morphine, oxygen, nitroglycerin, aspirin, and then I need to advise on lifestyle, smoking, diet, exercise, and I'm done. No, you have to manage the clinical scenario as well. You need to assess the situation and manage that particular situation, which varies from station to station. So the management of the situation is always there, and it needs to be there in your mind. Okay, number one. Number two, what are the three aspects that determines how well you score in your clinical management? Number one, coming to the right diagnosis. Okay, coming to the right diagnosis and explaining the diagnosis in the right way. Okay, in a way that it is understood by the layman. Like if you're just going to say and you say that okay, you've got subarachnoid hemorrhage, a layman wouldn't understand what subarachnoid hemorrhage is. Just say that a bleed in a major part of your brain, a bleed in one of the major blood vessels in your brain. Simple as that. Okay, so you need to be able to explain the diagnosis, not just the right diagnosis, but the diagnosis explained in a right way. Okay, that is one aspect. The second aspect is the management of the disease. Okay, like if it's a aortic dissection, a control of blood pressure, possible surgery. If it is ectopic pregnancy, then ordering beta HCG, running some investigation, running some scans, use of methotrexate, and then possibly a surgery, a BSO, to remove the ectopic pregnancy. So that is what the clinical and the disease, the management of the diseases. Okay, that is the second aspect of clinical management. Most of the people are able to do these two things. Okay, but they miss out on the third and the very, very important and the most important aspect, is basically addressing the concern of the patient. Okay, the problem that IMGs are doing, and the reason why they're not scoring well in the management, is because their consultation is not concern oriented. It is not concern oriented. throughout the consultation they just keep on asking questions. Okay, what's happening with you? Does it go anywhere? Anything that makes this thing better? Anything that makes this thing worse? Any family history, xyz, and blah 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 blah. Ask about, do you have any particular concerns as of today? And then they also bombard the patient, with the medical information that, okay, I'm going to admit you, I'm going to give you morphine, oxygen, nitroglycerin, a cardiologist is going to come and see you, we might also want to take you for a bypass surgery. But is the patient willing to take this treatment? Is the patient even willing to understand that, okay, he or she is going into a bypass surgery? You don't know. Because why? Because you never asked that, okay, do you have any concerns? Do you have any concerns? Am I clear so far till here? Do you have any query that you want me to address before I move on? And we do not ask about the concerns. You explain the diagnosis, you just assume that the patient wouldn't have any concerns. Maybe the patient doesn't want to know what the disease management is. Maybe the patient wants to know why he developed this condition. You are explaining that, okay, you are having a myocardial infarction, also known as the heart attack, in which there is a blockage in one of the major blood vessels. And then immediately you move to, I'm going to admit you, I'm going to give you oxygen, I'm going to give you morphine. Stop. Stop and hold your horses. Once you're done with explaining the diagnosis, ask, do you have any concerns regarding it? Maybe the patient wants to understand why he developed an MI. He or she is just maybe 35, 40 years of age, not that big of an age. They want to know that why they developed it. So your entire management would change. Okay, now you would have to talk about the risk factors. Okay, you would have to explain the risk factors to the patient, that, okay, you developed MI because you mentioned when we had a chat that you used to smoke 40 cigarettes in a day. Secondly, most of your diet consists of eat outs and fast food. And thirdly, you also said that your father also developed a heart attack. So let me tell you, Mr. Adam, that all of these three risk factors increases the risk of developing a heart attack in your case. That is what the management of the concern is. That is what the management of the situation is. And we completely ignore this aspect. We think that, okay, morphine, oxygen, nitroglycerin, and aspirin is the management. But no, explaining a particular thing to the patient, addressing the concern of a patient is what your real management is. Okay, and sometimes out of the 4 marks, there are 2 marks for addressing the concerns. And that is the reason why we are unable to score high in the management, because our management is not concern oriented. It is not concern oriented. Everybody, all of us are doctors. Okay, we know what the clinical management is, we know what the disease management is, but we are unaware, we do not know how to address the concern of the patient, how to manage the situation. Subarachnoid hemorrhage patient coming to you, you're just going, okay, I'm going to admit you, I'm going to do a CT scan. I don't want to get a CT scan done. Why don't you want to get a CT scan done? Why? Because I've heard that CT scan has got harmful radiation exposure. I don't want to get exposed to it and end up getting a cancer. So now your entire management changes. You have to explain that, okay, getting a CT scan is safe because because the benefit of getting a CT scan outweighs the risks, and that is the only way we will be able to figure out what's going wrong in your head. And let me tell you that subarachnoid hemorrhage is a potentially fatal condition. If it's not diagnosed early, if it's not managed early, it can probably lead to death as well. In a nice way, okay? You need to explain this thing in a nice way. So, concern oriented. And then once the patient has agreed that, okay, yeah, fine, understandable, and then you move on. Okay, then you move on to your management that, okay, I'm going to keep you NPO, we're going to monitor your blood pressure, we're going to take the neurosurgeons on board or the intervention leaders on board, and blah, 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 whatever, the management pointers are there in your head. So make sure that your consultation is always concern oriented. So this is what PLAB 2 is about. This is what is needed of you. A blend of clinical management, data gathering, and IPS. All of these things needs to be combined together in order for you to score high in a particular exam. All right. So with this, we'll come to the end of the first lecture of the day, first lecture of the course, sorry. And in the upcoming lectures, we'll be discussing what different type of sessions are, what are the do's and don'ts, and what is the structure that you need to follow, and how things work in the NHS, and what exactly is required in every type of station and every category of the station, so that we are able to provide you with the holistic and the most complete approach to PLAB 2 exam. And if you've got any queries and any questions, you can write them on the comment box, or you can reach out to the social media or to the contact numbers that are there in the description, and I'll be happy to answer one-on-one queries as well. So with that, thank you so much, and see you in the next lecture.